Hi, my name is Timothy Horanik, and today I will be presenting my research project on the effectiveness of fish oil supplements at reducing the reoccurrence of atrial fibrillation. So, first of all, what is atrial fibrillation? It is basically an abnormal heart rhythm caused by malfunctioning of electrical signaling. To the right shows a ECG depicting what atrial fibrillation kind of looks like. It's not typically considered fatal, but it can potentially lead to fatal complications such as stroke or blood clots. So, common treatments for atrial fibrillation. There are many options. However, many of these are just moderately effective, such as medications, anticoagulants. Yeah, any sort of type of medication like rhythm control or rate control can be used. However, it's not as effective. So, fish oil supplementation. This leads me into my research project. So, fish oil must be obtained from fatty acid sources, and the human body cannot actually create fatty acid omega 3s. So, that's why we take pills. So, 1,000 milligrams per day is pretty regular. There are mild side effects like heartburn, nausea, and diarrhea. So the study that I was looking at, we're basically trying to see if the amount of reoccurrence of atrial fibrillation increased or decreased, and we used a TTM EKG to determine whether a participant has occurrence of atrial fibrillation. So the study goal was to be able to compare fish oil to a placebo while also evaluating the effectiveness of how fish oil can decrease this reoccurrence of atrial fibrillation. So, again, the outcome is just whether atrial fibrillation occurred using a trans-telephonic electrocardiographic monitoring, which sends a message that tells the researcher, okay, this person is experiencing atrial fibrillation. This was under a 24-week time span. And in the study design and layout, there was strict inclusion and exclusion criteria. You have to be either at least 21 years old and you have to have a history of AFib. So continuing on, two groups were split over 24 weeks into the experimental group and the placebo group. The experimental was the fish oil and the placebo was corn oil. And there was some strengths and weaknesses. Strengths looking at a great exclusion criteria. It was randomized and double-blinded. However, weaknesses were that it was very, very short. So, for example, 24 weeks. So looking at the clinical trial cases, the ones that I had found, all of them, I found around 1,793. About 1,000 of them were interventional, about 600 of them were observational. Now, taking a look at the clinical trials using fish oil to prevent atrial fibrillation, I only found six. They were all interventional. I had about zero observational clinical studies found from previous research. Results showed that um, fish oil was kind of, or sorry, atrial fibrillation reoccurred in 46% of patients in the fish oil group and 73% in the placebo group, which is good. However, there was no p-value listed in the study. There were some serious adverse effects. However, fish oil and placebo, they both were very, very low, but fish oil was only about 1.5%, which is good. That's what we want. Placebo, about 4.69, still pretty low. However, the lower the serious adverse effects, the better. So again, there was a very, very small sample population showing that consumption of fish oil could be helpful with reducing atrial fibrillation reoccurrence. However, no p-value was actually reported, showing that fish oil to reduce atrial fibrillation is actually safe. Looking at some areas for improvement for this research, the design was that there were only 4-gram doses. There wasn't a p-value, and again, there was a very, very short follow-up period. Um, some considerations can be that taking a specific class of medications to kind of better isolate the effects, and a study should have a variation of weights between the participants. And thank you so much for watching.